You're listening to On the Way Home with your host, Emmy Kelly.
Welcome, Tom. Thank you so much for joining us on the way home today.
Thanks, Emmy. A pleasure to be here.
We're going to start with our signature question, but I know you've already been on the show, so if it's changed for you or if there's anything new you want to share with the listeners, please tell us what home means to you.
Yeah, really, when you think about just how kind of important home is to us as individuals, to us as communities, and as a nation, right? It's a really good question. But for me, it is about kind of comfort and about familiarity, right? And I think kind of when I returned from being away from home for a while, kind of when you walk in that door, just the feeling that you get, right? You're in your place and you're in your surroundings. And I think it's it's a place that we feel safe, and it's a place where we can bring our friends and meet people and build kind of relationships in a space, as I said, that's very comfortable and engaging. So I think of that kind of at a very personal level, how home feels. But then I also think it's how my home is part of the space, the community around me, right? And your neighbors, and how you interact with them, and how you access things, and how your home kind of helps you to do all of that. So that's what to me, it's a feel, it's a place, it's about kind of permanency.
And so could you share with us a little bit about your personal journey to where you are now as CEO of Toronto Seniors Community Housing, but what brought you there, and your passion and journey in housing?
And I never imagined that I would be in this area of housing kind of when I started my work, but just so glad kind of it found me. But I did most of my kind of professional life has been in the area of long-term care, working with seniors and support in the community. And really I would say it was more from kind of the health perspective with seniors, as I mentioned, in long-term care, and there was some work in rehab. And then when I was the administrator of Wentworth Lodge in Hamilton, an opportunity came up at the city to kind of temporarily lead City Housing Hamilton. I didn't have a lot of experience in housing, knew very little about it, and so it was kind of like being fed right into it. But but that being said, it was a huge kind of learning curve, understand housing, and I was very interested in it, and just really understanding more how it kind of supports kind of people as individuals within the community, and just how integral it was to our communities. And I was there for my interim role became permanent, and so I was there for, I guess, 8 years. And then this opportunity came up in Toronto, where they were forming this new seniors corporation, really kind of separating from Toronto Community Housing. All of their seniors buildings was becoming a separate portfolio, separate corporation. And so, combining my experience in seniors and then with housing, to me, it was like, boom, right? Like that was like the perfect match. And so I was there, and, it has just been, a really positive, really good experience.
And did you already, I'm guessing, like in your transition from long-term care into housing, did you already see like so many of the connections between?
To be honest, no. Because in long-term care, people, people, whether it was from their home or come from an acute crisis in a hospital requiring admission to long-term care, and then very few people kind of leave kind of long-term care for alternate accommodation. And so I really didn't have a lot of familiarity with the housing system, that the social and public housing system. But now being in the social and public housing system, I think, and where we are in that environment today, it has been really helpful to understand those relationships with long-term care, those relationships with people who are leaving their home or from precarious housing. So that I think has really helped me understand more of that spectrum around housing, and particularly how we support people in various housing.
So bringing us to today, where you're leading services for over 15,000
Yes.
seniors
Yeah, yeah,
across
yeah.
83 buildings.
It's a little
Is
city.
that
It's a little city.
tiny city? um, and that was also a split, right? From
Yes.
Toronto Community Housing. What does that responsibility look like for you?
Yeah. So I mean, it's at various levels, right? As you know, in this position as CEO. Although I do have to say, like Toronto Seniors Housing is a relatively kind of a flat or organization, and our focus is solely kind of on the tenancy management aspect, not solely, but primarily tenancy management. The buildings are still owned by Toronto Community Housing, so it is a real. I see a real opportunity for us to look at, providing, the accommodation, the unit for somebody to rent, ensuring that it's maintained, kind of optimizing safety programs and supports for those individuals. We do have positions, community kind of, they're called custodial maintenance positions. So some smaller maintenance work is done to support the tenants, right? And so when you look at, when I think of like my day and what's coming through my my emails, it's the complete spectrum, right? So when you think there's 15,000 seniors at some point, and often they're, what are those kind of issues that they are dealing with individually that kind of percolate up to my level, that require, like, because of the high degree of risk, or how that could affect a policy, like, so dealing, on those kind of, in some of those individual kind of acute or issue management is part of the work. And then it's those, from the operations, right? So kind of working with the other leaders, managers, staff around things like vacancies, right? How do we optimize vacancies, arrears? Like, how do we ensure that we're supporting the tenants so that they can access the finances so that they sustain their stable housing, right? And then those partnerships, how do we better enable partnerships? So working with the directors and the staff and trying to map out, what partners, what supports kind of would be optimal for the different regions. And so that's kind of that operational aspect of the work. And then there's of course like the strategy aspect, right? So here we are, I think, a relatively unique organization. Our sole focus is seniors and social and public housing, primarily rent geared to income, right? So how do we become and create kind of like best practices in that area, for others to identify, so for others to perhaps use in terms of their work with seniors, and just looking at what links do we have to make with other organizations, within government, right, whether it's municipal or provincial, to really to help kind of promote more stability in the housing sector, get more of those supports and partnerships into our building. So there's the day-to-day kind of issue, larger operating aspects of the work, and then and the strategy. And I also, for me in this role, and I think working with seniors in particular, visibility is important, and being present with seniors to kind of understand what are specifically kind of some of those issues, what are some of those challenges, and kind of being on the ground to work, and hear them and work with them and staff, to resolve matters. So for me, that's important as well. And we, as in any organization, there's some larger projects, right? So we with seniors in the considerable diversity in our building. So our translation and interpretation policy, right? That was a huge lift, for our organization to understand, what our tenants required, how do we support them, things like translation and interpretation. So those are some larger projects as well, where I can infuse my time to help move them forward and provide leadership. Yeah. Oh, I can't hear you. Emmy, you're on mute.
Sorry. Now I'm tripping off, but when you said about the interpretation pieces, it made me interested, like
Yeah.
how with the, influx of new Canadians and all of that,
Yeah.
how do your staff like to use Google Translate or?
That's right. That is part of it, right? And I think this is a really, I think, untapped frontier in a way, and and it's just not about that initial translation and interpretation, right? Because what we're learning with the tenants, we talk about a lot about digital literacy, but there's things like health literacy, right? So in terms of when people, don't, communicate in the primary language, then, how do you interpret, how do you translate, so they better understand what support's available, what health is available, how they can better use technology. So it's really, there's a lot to all of this. And yeah, Google Translate is one of the ways, but we also, technology, many seniors do use it, but we recently did a tenant survey, a satisfaction survey, and still like 95% did it by mail, right? We mailed it to them and then mailed it back. It was only a small percentage that used technology. So when you think of the way we use technology to kind of access information now, or get access to service, we have to look at, what are those ways that we work with our seniors to better, to support them. And then subsequently, our website, right, when you go on it, you can translate into, numerous different languages. When our tenants speak, so that's the newsletter goes out to tenants, we can produce it when requested in 13 different languages. And so we are really trying to work on understanding kind of who is in our buildings, what are those languages and different cultures, and how do we support that? It's really interesting stuff.
And so across your successful career so far, what's been like your why and your motivation?
Yeah, so for me, it is about the connection, and the working with individuals, and then too seeing kind of the outcomes of that work, right? So, you know, I guess in the almost 4 years now that I've been with Toronto Seniors Housing, have been to like all of the 83 buildings pretty well twice, and so so to me that's a really important element of not only meeting with the tenants but also meeting with the staff, and so that's very kind of important in being kind of understanding at grassroots what's happening there. But then then that helps you to understand, okay, so if we want to, in speaking to tenants and stuff, if we want to really kind of move on something like there's our Community Connect Plus, which is our tenant engagement, right? So you look at what is the framework under which we want to work and engage with tenants. And when you see, and we implemented our Community Connect Plus, and we saw our kind of volunteers, we call them our tenant volunteers, go from roughly 75 to over 300 now, to really help those to help guide the work of the organization. That's the work that really feels good. And for some, also in the area of something like vacancy and housing stability, when the corporation first started, our vacancy was around 5%, right? So when you have 15,000 units, that's representing like 750 vacant units, which aren't available for people to rent. And we worked with the staff to really put in changing processes and working with the city. And now that vacancy is at 1.7% or lower, and so you can't get with regular unit turnover, you can't get that much less. But that's very satisfying, to know that you're providing and really optimizing the housing that's available. And even in things like people's ability to pay their rent. I mean, we also often refer to arrears, what people don't pay. But when you think about what they are able to pay, there has been some very good work and processes in place, working with staff, working with tenants, where our average arrears amount owed per tenant across the corporation has steadily declined, right? Which means you're stabilizing their housing. That stuff is what really kind of gets me excited about this work. It's not only like the day-to-day interaction, but it's when you kind of make a quantum shift in how you are providing supports to people.
Can we go back to Community Connect Plus that you
Sure.
referred
Yeah.
to, and explain like what it is and how it's helping to strengthen tenant engagement and build that sense of belonging in your programs?
Yeah, and yeah, it's pretty. I think it's pretty neat. And and it was really, it was, you know, co-designed with staff, with tenants. And one of the first kind of my first marching orders coming into the new CEO of this organization is, you know, what is the framework in which we want to kind of interact with tenants, engage with tenants. That's what the Community Connect Plus is all about. And you know, at the end of the day, we and there was organizations such as Ottawa Community Housing and other organizations that we spoke to. And previously, you know, when I arrived, there was what were tenant leaders. So, you know, an individual was identified at some point before the organization was formed. It was either by election or sometimes just selection of an individual. And there was only half of the buildings that had these tenant leaders. And so, you know, a lot wasn't happening in the others. So it was like, okay, so how do we change this to get kind of more involvement? And what we chose, and it was through, I think a lead organization was Ottawa Community Housing, who had these tenant circles where tenants kind of self-identify, you know, wanting to participate. We have what are called community service coordinator positions, staff positions, who they convene a meeting with the tenants, and they discuss, you know, what are services that you would want in this building, what are some of the activities that you would like to help us coordinate. And so this is where, you know, we now have over 300 tenants involved in these, what we refer to as tenant circles. So, you know, it's all about kind of people agreeing to what they might want in their buildings. It's just not one or two individuals guiding that. And we, you know, as we said, we refer to them as tenant volunteers. And then from that group of individuals, we hold regional meetings. And so they come together 3 or 4 times a year. We have 4 regions across Toronto Seniors Housing. So the tenant volunteers can attend the regional meetings. And then, and so then as part of the Community Connect Plus, we have the Seniors Tenant Advisory Committee. So they're representatives from across the entire organization. And then we have 2 tenant members on our board. So it's really, you know, at all kind of levels of the organization, we have tenant representation, and then it's spread right across the entire portfolio. So it's not perfect. You know, there's still kind of there's growing pains with this as well. But I do, you know, from feedback and do feel that, you know, the tenant's ability to participate, whether we're looking for feedback on a policy, or right now we're developing a tenant volunteer program or tenant volunteer handbook, they all, you know, it is all done kind of with the tenants. And so I think that ability to kind of strengthen that voice and input really helps to the final product.
Yeah, I mean, that's incredible, the way you've structured all of that and to have the tenant voice at on every table.
It's yes, yeah, and yeah, it's just, and I also think too that involvement from them to whatever degree, right? So it's not the participation, for example, in the tenant circles is not prescriptive, right? You don't have to be there at every meeting, and then when activities are held in the building, you get to participate to the extent that you like. You know, for some individuals, they would like more structure around that, kind of more commitment, but we'll see how that plays out.
Very cool. And what did you say?
No, I said thanks. Yeah, no, I think it is.
No, I think so, because often in this line of work, it's the discussion, right? How do we have the voices of those that we're serving at every table, and, you know, in everything that we're doing and the policies we're building. So that's pretty cool.
And even I'll just throw in with for example, the recent tenant survey that we're starting to get the results in, like, you know, our senior tenant advisory committee, you know, kind of, they reviewed those questions, and they had some good input about how we might want to adjust some changes or not ask certain questions. And I think that's where that voice is very important, right? So that it really helps to get a better understanding and better buy-in for those, you know, kind of either activities or, you know, processes that you put in place.
So then I'll just, like, building on that, why do you believe that creating those strong connections is so important when it comes to seniors aging well in their homes?
Yeah, well, so I think at many levels, you know, one, you know, that when and this just came out of our recent survey. When tenants are more connected, they're more satisfied, right? And I think, like, from a quality life perspective index, right, that satisfaction is really important. That's not true for everybody, right? The survey also said that like 50% of the tenants are just not interested in participating in things in the building. But understanding that when for those people who want to and are, then that becomes kind of more motivating for them, and that sense of belonging. So I think that's really important. And also, there is a correlation between kind of engagement and safety, right, within a building. When you have a more active building, right, that helps to promote a better sense of kind of belonging and safety within the building. So we want to push it from that level as well. And then also, people, that involvement, what I see from where there's more participation in a building, let's say even when they do a coffee club, and they can invite tenants from other buildings, but there's an incredible amount of kind of cross-pollination that happens around information sharing, right? So if you're all of a sudden having coffee with somebody who is saying, I'm having trouble, with ambulating in this way, is there a physio, or is there something, is there access to a service? They can either say, oh, well, the senior services coordinator can help you, or I have this individual. So I think that kind of organically it helps the communication of information, providing supports. But then there also is in a structure that they can refer to help to do that as well. So I think that's that connectivity is really key. And I remember when I was a long time ago, doing my kind of graduate study work, this study that was done to say that the singular most important variable for people to remain in their home is remaining connected. Right. And that connection does not have to be, participating in an event. It can be a phone call, right? Or it can be a visit. And so that, I think, for us as an organization, and for our mandate, kind of that connectivity, whether it's staff with tenants, tenants to tenants, tenants in their community, it's key. It's foundational.
So when you said at the start, like, that your team basically does almost like service delivery, not like the building maintenance,
Yeah.
do you have staff kind of working to provide that connection for seniors all across your programs?
We do. We have positions that are called, and this was part of when with the formation of Toronto Seniors Housing, there was it was part of the construct was like this integrated service model, and part of that integrated service model involved senior services coordinators. So we have roughly 45, so one for every 2 buildings, and those individuals, their focus is to help tenants. One of the areas of their work is to help tenants access service, so that so somebody comes to them, they're having trouble with a primary care physician, or there's another type of healthcare professional they want to access, or there's a program, recreational program. Our senior services coordinator can help connect them to that. The other, what we're also finding with the senior services coordinator, is they're working with our tenant service administrators. Those are people who help make sure that all the paperwork is in place to submitting their annual review, right? Getting the CRA documents for the submission. So we have staff kind of assisting tenants in that way. The other position that we have are community service coordinators. I spoke with them as well, and they're the ones who help to bring partners or services to the building, right? So it's not only about helping the individual tenant, understand what services they could access in the community, but are there opportunities to bring those services to the buildings? And then the senior services coordinator, they also help these individuals, also help to kind of negotiate relationships within the building as well, right? If there's tensions between tenants who are living side by each, they can help to work that through as well.
And you have been working with, so Toronto Senior Housing,
Yes.
has been working in collaboration with Ontario Health.
Yeah.
Can you share what those partnerships look like and the impact they're having?
Yeah, so I would say, like with Ontario Health, and we're also working with a Dr. Gina Agarwal out of Hamilton, and though they're early part. Well, the one, Ontario Health isn't early, but the work that we're currently doing with Ontario Health and Dr. Agwal, one of the areas that we need better information on in housing is who is in our buildings, right? So in the Housing Services Act, all that's required is that people have a good rental history and they don't have some type of significant crime. I'm not sure exactly what to label within the last 5 years. Other than that, they are able to rent a unit at Toronto Seniors Housing or any a public and social housing unit in the city. And so that's there's the positive aspect of that in terms of access to that unit, but it's also like we don't know who's in our buildings, right? So and the lease says you live independently within the building. So we have many tenants who, through their, let's say, GP, have coordinated home care to come in twice a week to assist them to remain independent. We may not even know kind of who those individuals are, and so with what we're trying to do now is, through kind of data and information, establish who is in our buildings, and what type of impact is that having on kind of the health system. Because if we can put supports into housing to minimize people going to hospital or accessing the health system more, those more costly aspects of the health system, that benefits all. So one of the things that we're working on Ontario Health and Toronto Community Housing as well, are the other kind of corporation with the city, is looking at a data set that helps us to determine kind of who is in our buildings, and then along with and what services are they accessing, hospitalizations. And then with Dr. Agarwal out of Hamilton, once again, just really looking at almost the individual building level, who is in our buildings, like what is the profile as it relates to certain health markers, whether it could be diabetes, congestive heart failure. And so if we understand, if we have a higher percentage of that type of tenant in that particular building, then what type of supports or services could be beneficial to that building, and understanding what in the vicinity, right? Are there the work that Dr. Agarwal is showing around the community around us, what is available to the tenants, right? So we'll be able to kind of promote that more, or offer suggestions where to go to access that. And so that work with Ontario Health and Dr. Agarwal is really looking at understanding kind of who is in our buildings and what is the need. It was very interesting. Like when I was in long-term care, right? Everybody, you were assessed to death when you came into long-term care, right? We knew exactly what you were needed, what the resources would be that we would allocate towards that. We know nothing of that in housing. And there was a point in the system, I was supposed 20 years ago, when it was really more about providing a unit for people to rent. But as there's more pressures on our housing system, people are maintaining in our housing. Our mandate is for people to, support them as they age at home. This whole element of understanding what supports they need is I think is critical, and will really help us build kind of a better system of supports for people, not only in housing, but people coming from, let's say, precarious housing or leaving to other types of housing. And so we're quite excited about this work, and we're just now starting to receive some of the information from Dr. Agarwal. So stay tuned.
Ooh, exciting!
I know, and I'm hoping that it catches on, so that it's just not only Toronto seniors, right? And how do more social and public housing rent geared to income operators get this type of information to help understand what their tenants need.
And you've mentioned safety quite a few times, which is obviously very important in our work, probably even more so with seniors. Like, could you share with us what are some of the initiatives that you've launched there?
Sure. And I think to start, this part of our conversation, I mean, this is probably one of the number one concerns for seniors in our building. So with with the most current tenant survey, and even the one previously, roughly 80% of our tenants feel safe in the unit in our buildings. However, when I am with in the buildings, and staff hear it, or when we hear the actual incidents that are occurring, safety is probably the number one kind of risk issue for us in terms of work with our tenants, and that safety aspect happens at once again, it's not kind of a singular type of safety, incident, right? There's individuals who just want to seek warmth in our buildings, and so they will tailgate a senior into the building, and they want a warm stairwell. But seniors perceive that as a safe, it can be a safety risk to them as well. But I would say seniors are very concerned about that from a safety perspective. The rest of us or others might just think, we just really don't, we prefer that individual not to be sleeping in our stairwell. And there's, kind of issues of traversing the stairwells, which becomes a risk. But those are, that's kind of an element of safety. And then there are those incidents, like I would say, very high risk. We do have kind of like unit takeovers. It can happen, right? A drug dealer gets, familiar with one of our tenants, they take over the unit. It's devastating, and it just completely can change the culture of your building. It's very hard to get them removed from the building. That's a whole other matter. But then there's also those safety issues where, as people age in home, and as people they can have dementia, right, or psychosis, and if that becomes threatening to other tenants, we can't respond to that as quickly as other elements of the health system or even individuals in their home, right? So if there's somebody whose dementia or psychosis is progressing, they have to agree to get that support, and it can be hard to get that support into the building, and for us to relocate them if they don't want to go is extremely difficult. And so there's this area that one of the areas with safety and security relates, just to some of these aspects of when an individual has kind of responsive or assertive aggressive behavior, how that's impacting other tenants. And so, we work with our staff, to help understand how to follow up on some of these matters. The Toronto Community Crisis Team is now available, right? If somebody that you can call if somebody's having a mental, health issue. And so, there are ways to operate that. The Toronto Community Toronto Community Housing through the Community Safety Unit, they provide. They can provide third-party coverage in our buildings. They can provide their community constables to come to our building. We have the Toronto Police Services. So there's various ways that we address safety in the building, but we still have a lot of improvements to make in terms of how it is responsive, right, and timely, and it is the support that the tenants need. And then we also need a better ability to work to move people to another kind of more appropriate kind of accommodation or living arrangement, or not in our building at all. And that can be really difficult. So, oops, I think you pressed mute again, Emmy.
Sorry, so difficult. I was saying, like, I can't imagine. And maybe if you would share anything more about like how you balance the tension there, because you're obviously really doing amazing work at like integrating tenants into all the work you do and creating a very welcoming housing environment, and building sense of belonging and everything. But then there's some very high safety concerns. How do you navigate those successfully?
And I think it points there is success, but we aren't doing it nearly as well as we should. And if you talk to housing providers across the province, like social housing providers, this is a challenge for all of us. And as things such as kind of mental health issues become more known or more prominent with aging, and we don't have the supports necessarily within our community to assist with those, right? It's challenging to do. That being said, key to safety and security is for the seniors is to know that we are being responsive, right, and we are being timely, and we are working with them. And I don't, to be honest, I don't think they necessarily always feel that we are doing those things as quickly, as we can, and as comprehensively as we can. And we try to work with them to share what our challenges are and what our limitations are. But at the end of the day, it is their perception and their reality around the safety and security. And so so how and it's also just not about Toronto seniors. This is a community issue, right? So where some of our buildings are in the city, you know, a drug use around the buildings, the homelessness issues around the buildings, you know, they have a way, just because if they're happening more, you know, people can find their way more into our buildings with vulnerable individuals in them. So, you know, it's part of our work is looking at more community approach to safety. So it's just not you know, it's just not about necessarily the behavior. Is it the environment around the building, right? Do we have the right lighting? Do we have, you know, the right coverage at at the building? You know, what is, you know, what is happening in the community around us that we could potentially impact, or organizations that might help to support us? So we're thinking of it more, not just kind of the building, but more the community safety. And we're working closely with Toronto Community Housing, because they've been doing some really excellent work around this whole aspect of community safety, and that the community wellness, not only but community wellness and safety plan for a building and its surrounding communities. And so we hope to do, you know, no, our intention is to do more work in that area. It's just that you know, that we face these challenges kind of as a society, as a system. And I really think that it shows up a lot in social and public housing, you know, because of where the buildings are located, the profile of our tenants, so forth and so on. So, you know, we're trying to make sense of it, but it is an area of risk for us.
And what about the conversations around delays at the Landlord Tenant Board? How
Yeah.
are these? Yeah.
So honestly, you know, I guess I can say that, you know, we hear they're trying to make changes at the kind of the Landlord Tenant Board to hear these cases more, and, you know, I think be empathetic to both the tenant and the housing provider. I don't necessarily believe, though, that let's say the Landlord Tenant Board fully understands the degree of risk that exists in our buildings, and the effect that some of these tendencies can have on quality of life, right? So, you know, we've you know, I could, there's several buildings right now where we know where there are units that are problematic, and, you know, we have the documentation, and, you know, the tenants know, staff know, we present to the Landlord Tenant Board, and they stay the eviction, right? Or they allow the person to stay if they change this and this. And I don't mean to be, you know, I'm just trying to be factual about what's happening. And it needs to change, that if these people, that's a terrible way to phrase it, but if people are going to stay in the building under those conditions, well, then there has to be some supports for the individuals who remain in that building, or, you know, you can't have criminal activity happening, people knowing about criminal activity in your building, and yet them having the ability to stay and not change where would be a better location for them to live. And it's incredible that when there is an eviction, how quickly the culture of that building changes. Like, if those one or two units and individuals in those units are present in the building, then it completely changes, you know, the environment and the feeling of that building. And I don't want to. I hope this doesn't sound dramatic, but it's what's happening in instances, and it's a handful of our buildings, but it is still, it's very threatening. It's very high risk, and as a system, we need to better, you know, we need to be more responsive to, you know, who is getting into that, you know, who's occupying that unit initially, right? Because we do no assessment, and then once they are there, you know, are there supports that can help change that? And then if not, you know, we need to be responsive about moving those people elsewhere. You know, social and public housing is also seen as the housing of last resort. I think the adjudicators also feel, well, if they weren't here, they'd be on the streets. And that is probably true in many instances. But the thing is, where if they stay in the building, they're disrupting the lives of tens and it can be, the entire building. And so it's not easy. It's a real area of challenge and risk for us right now.
Have you seen like models of like, has anyone cracked the code on how to manage these tensions? Like, have you seen models internationally or anywhere in Canada where
So yeah, that's has somebody cracked the code. I think, yeah, my feeling is that kind of cracking longer term, we would have more success dealing upstream on this issue, right? So people have easier access to housing, right? And availability of housing and to move to different housing because whether it's long-term care, social and public housing, shelters, because it is so limited, it really jams up.
creating a desperation.
It creates a desperation, right? And so how, those countries that have that don't have as many of these challenges, they have more housing available for people, and they have a strong safety net that surrounds the communities and available to address it. So if you look at the Scandinavian countries, for example, or a city like Vienna, they have created a lot of housing for people. So you're dealing more at the front end as opposed to some of these high risk situations at the end. And I do think it is, having a better understanding of who's in our buildings and what is their need and how do we best support them too, that can be helpful. But I think too, though, I don't want to create, when you look at, the 15,000 people who are in our buildings, right? Like you hear the stories of just how fantastic it is that they have found this place to live. It's affordable. There are things, supports, and so there's the real positive aspect of it. We're just right now, kind of spinning in this area that does create tensions in housing.
So before you go, can you end by telling us what it is that gives you hope and what's your vision? No, what's your vision for the next few years in Toronto? Community housing and
So I ever, shortly after I got into housing, and when I was in Hamilton, we started to do this project where it was a renew. So when I was in Hamilton, I also was involved kind of in the capital, the renewal side, the revitalization of the portfolio as well, and we worked with ERA architects around one of the first kind of high performance tower renewals in all of North America, right? So the triple glazed windows, the the insulation of the building, kind of high performance, really optimize the living environment. But as part of that work, we really got thinking and talking about it. And I know, this is my aspiration, and I think it will happen after I'm out of the industry, but it's really changing the narrative around social and public housing in particularly in Ontario, where it is seen right now, we speak of it as, what is the subsidy? It feels like it's a burden to our system. Whereas, we want to flip that to see it as a really vibrant part of our community. And it can be that. And the tenants and the staff, and we are working for that, but we need to understand it not simply as a place, where people get, cheap housing because they need it. That's not the case at all. There are countries or cities like Vienna where it is people desire to live in social and public housing. Middle class people live in social housing, housing supported by the government. Why can't we change that narrative here in Ontario or in Canada, right? And so it's a bit of a dream, but I keep thinking that in what we do, right, it is really, people, feeling really comfortable and energized and positive about where they live in like rent geared to income, and so that we are a positive influence on each other in our community and not necessarily seen as a drain on the community. So that would be my kind of aspiration. It won't happen in 2 years. I hope it happens in 5 or 10, but I don't know.
Hopefully. Well, thank you so much, Tom.
Amy, thank you. Really appreciate it. Yeah. Okay. Always good to see you. Bye-bye.
Bye. Today's episode featured Tom Hunter, CEO of the Toronto Seniors Housing Corporation, whose leadership underscores the importance of community, safety, and integrated supports in helping seniors age well at home. His work highlights how strong partnerships, tenant engagement, and thoughtful system design can create environments where seniors not only live, but truly belong. Thank you for listening to On the Way Home, a podcast brought to you by Blue Door. Stay tuned for more conversations exploring housing solutions across the continuum of care.
You're listening to On the Way Home with your host, Emmy Kelly.